Blinkist is the app that helps you become a more well-rounded person by letting you read or listen to an entire nonfiction book in just 15 minutes. You can try it for free and get 25% off a subscription by going to Blinkist.com/David Pakman. Let's start with the most fun possible segment we ever do, which is a review of where we are with the coronavirus pandemic. I know it's really a party. We haven't done a review of COVID cases and deaths lately because it's just been so busy on the show. But now in the context of some declining vaccination and changing mask guidelines, which we will get to, this is worth doing. I believe we are now 3 weeks from a massive reduction in COVID cases and just a little more than 3 weeks from a massive reduction in COVID deaths. Now, keep me honest on this. This means May 19th, 3 weeks from today. I've marked it in the calendar. I believe COVID numbers will be looking really good in the United States, and we're going to come back and see if that actually happens. Let's start with cases, and then we'll talk about what's going on. So to begin with, as a reminder, the U.S. has had essentially 4 case spikes. The first was that first spike in March of 2020. The second in July of 2020, summer of 2020, the third and the biggest in the winter of 2020 into January of 2021. And then as cases started to come down rapidly during the vaccination phase in February and in March, cases kicked back up a little bit. Why did this happen? Well, it's believed that it was because some people started going nuts too soon, even though they weren't vaccinated. And then also we had that British variant, the B.1.1.7 variant in the northeast of the U.S., in Michigan, and a few other places. And it was actually starting to outrun vaccines. We seem to have turned that around. Case numbers now coming down in Michigan. It now seems we've vaccinated quickly enough that we are back into some semblance of control in what is big picture an out of control situation. Remember that the vaccines work well against all the variants, to some degree, less so against the South African variant, but still does well. Cases are now down about 20% from that mini peak a month ago. So from that little peak, we're already down 20%. We're down 78% in cases per day from the big peak in the middle of January. That should continue down. Now the death curve. The death curve has been more nuanced, but it also didn't really experience any resurgence in the past couple of months. Even though cases went back up, deaths did not. Deaths peaked in late January around 3,400 per day. Just an incredible, horrifying number. They are now down to about 725 deaths a day. Still terrible, but continuing to decline. We are down about 80% in daily deaths. But 20% of that peak is still a lot. The death decline can take longer because, quite morbidly, it takes time to die from COVID. So there are people who have been sick for a while who will continue to die even as more people are protected by the vaccine. People who would have died in June, did they not get vaccinated today, it takes a little time to see the impact of that. But by Memorial Day, hopefully, death numbers will also be really low. Now, unfortunately, these case and death declines are coming as we are seeing reduced vaccination numbers. This is not because of the brief pause to the Johnson & Johnson vaccine. It is not because there aren't vaccines available. This is increasingly a demand issue. After a long period of vaccination increasing all the way up to an average of 3.5 million doses per day, we were hoping we would get to 4 or even 5 million doses per day. We did not. We are now back down to 2.7 million doses per day, continuing to decline, only 2.1 and 1.7 million doses per day in each of the last 2 days. There are lots of vaccination centers in blue states, red states, north, south, everywhere saying, you don't need an appointment, just show up and get a vaccine. We should soon see approval of the Pfizer vaccine for people aged 12 to 15, hopefully Moderna as well. That will add people to the demand. But we are getting to where more and more of the people that want a vaccine have gotten it, or at least a first dose waiting on a second. So we are now going to need new initiatives to encourage people to go out and get the vaccine. Today, I will be talking about Joe Rogan's recent anti-vaccine comments, which I find very dangerous. Many of you wrote to me about them saying, David, why won't you criticize your friend, Joe Rogan? All right, well, we're going to do it today. It's very dangerous. We do not need things said now that will encourage people not to get vaccinated. So that will, yes, I will talk about my friend Joe Rogan. We will talk about it today. But even if we can keep doing 2 million doses a day, we're still going to be looking quite good by the middle of June. And that's where we are today. This stuff matters. We now have, as I told you earlier, more relaxed, as I told you yesterday, we would get, and we will discuss in detail later today. I realize it's unclear to say I told you earlier. I told you yesterday, and now we have the new guidelines. We have more relaxed mask guidelines because people have been getting vaccinated, because the vaccines are so effective. At the same time, we're nowhere near out of the global catastrophe. I'm putting up on the screen the chart, the case chart from India, which we discussed on a previous show, and it is a disaster. People are literally dying in the streets in India. A video came out of two sons on a motorcycle transporting their dead mother, holding her upright on the motorcycle because all services, she died of COVID, all services are collapsing in India. Even in Canada, cases have been spiking and things have not been looking so good. So this will be a continued and long global process, which will hopefully look much better in some countries as soon as a few weeks from now. We're going to get to the masking. We're going to get to the vaccination later. But that's where we are on cases and deaths. To shift gears a little bit before we get back to COVID stuff, as we discussed many times during the presidency of Donald Trump, the humiliating and cartoonish nature of Trump led to many of our historical allies being distanced from the United States. Canada, France, Germany, others. The U.S. was increasingly not a part of major global discussions on important issues, climate, of course, being one of them. Why on earth would a Trump-led United States be part of climate discussions when Trump said climate change was a hoax created by the Chinese? Allies talked to each other, but they increasingly did not involve Trump and the United States. And the reputation of the U.S. was in the toilet, a toilet that Trump was flushing 10 to 15 times. Remember that? Our reputation was in the toilet. And exactly as predicted, the reputation of the U.S. is coming back quite quickly. I got a lot of phone calls during the transition period from Trump to Biden saying, do you think we will recover our reputation quickly? And I said, I think we will, because much of the world is eager for a non-cartoonish president. And the U.S. popularity has improved significantly in several countries since Joe Biden took office. This is data from the latest Morning Consult poll. Looking at the list of countries, our standing abroad has increased dramatically. In Germany, where our favorability has almost doubled from 24 to 46%. Germany is followed by Japan and France, where our favorability has gone from 36 to 55 and 29 to 46, respectively. Now, to be clear, these are not exactly stellar numbers. Despite major improvements, 37% of Germans, 22% of Japanese, 29% of French see the U.S. negatively. Never mind other countries like Canada. 47% of Canadians see the United States negatively. But the point is, what is happening in the real world actually does get paid attention to, and it has an impact abroad. It's not a capricious negativity about the United States. Trump out and favorability increases significantly. Now, anecdotally, Americans are also less stressed day to day because the former president, was always at risk of making some horrifying blunder and unleashing global shame and embarrassment upon us. We no longer worry about that. As important as it is to realize that our reputation does respond very directly to who is the president and to what the president is doing, it's also important to realize that this could happen again. Most Republicans still like Trump. Most Republicans still believe Trump won in November, if you can believe that. And most Republicans would vote Trump back today if given the chance. Despite the successes of Joe Biden in his first 100 days, vaccination, COVID stimulus, rehabilitating to some degree the global reputation of the country, I'm hearing from friends and relatives in a variety of countries, including France, Belgium, Argentina, where I was born, Israel. It's primarily a feeling of relief that Trump is gone. And relief gets you part of the way, but it doesn't get you all of the way back to a recovery in reputation. Sadly, most of the world understands what in this country, nearly half of Americans don't understand, which is it's objectively bad for us and everyone else to elect an incompetent buffoon like Donald Trump. It really shouldn't be done again, but it might be if they get a say And if they're able to suppress the vote enough in 2024, remember, they didn't suppress it enough in 2020. They tried, but they failed. If they succeed at voter suppression to a greater degree in 2024, Trump could be back or someone like him. Now, lastly, just because Joe Biden is restoring our reputation to some degree and doing good things doesn't mean bad things don't still happen. They do, and we have to keep paying attention, which is exactly what we're doing. In a sense, boring politics is good, but it can lead to complacency as a result. And that is exactly how Donald Trump ended up coming to power. Nah, he has no shot at the Republican primary. Oh, he won the Republican primary? Well, there's no way that he can beat Hillary. I don't even know if I'll vote because it's just not going to be necessary to defeat Donald Trump. Oh, Trump beat Hillary? Well, then what? Boring should not mean we don't pay attention, but it's okay for it to mean less constant stress about which rights is the president trying to take away from people or media or from whomever. We are going to continue following the reputation of the United States around the world, much improved in many countries, but nowhere near where we should want to be. Let me know your thoughts. You can find me on Twitter at @Pakman. And boy, do we have a good show for you today. I think we should actually record and keep today's show, which is not what we always do, because today's is actually a pretty good one. What if you could read 10 books in just one sitting? That's exactly what one of my favorite apps lets you do. It's called Blinkist. And what they do is take thousands of popular nonfiction books. They condense them down into text or audio that you can consume in 15 minutes. Blinkist makes sure that you're getting all of the important core insights from each book. So it's perfect for exploring a book you otherwise wouldn't have time for. If there's a full book you're thinking about buying, you can use Blinkist to get a sample first. Just think how much you can enrich yourself by being able to soak up an entire nonfiction book in just 15 minutes. I recently read A Brief History of Time, of course, by the great Stephen Hawking. This is a book that I have been aware of for so long, and other things got in the way, and it was fantastic to check it out on Blinkist. Blinkist has books on politics, philosophy, science. They have 27 different nonfiction categories, and a subscription is only about $8 a month. And you get the entire library. But you can try it totally free and get 25% off a subscription when you go to Blinkist.com/David Pakman. I've put the link right underneath this video. Hey, remember to grab those memberships. We've been seeing some massive dumps of new memberships lately. People taking advantage of the secret unpublished coupon code Immoral21. It is an immoral coupon code, but it's certainly not illegal. We've confirmed that. You can use the code on the membership of your choice at joinpakman.com. The vaccines work so well, and enough people have gotten them, that the CDC has announced no more outdoor masks in most situations for vaccinated people. Now, if that sounds underwhelming, or if your reaction is, a lot of the country's already been doing that, these guidelines, of course, are for people who are following CDC guidelines. If you've not been following them all along, then you don't really care what the CDC says. You're probably not getting vaccinated either. You probably have been letting it rip. But for those of us who care what the CDC says and who have been following Joe Biden's agreement with CDC guidelines. Remember, these aren't Biden's guidelines. They are just Joe Biden saying, I will listen to what the health experts say. The CDC yesterday announced that outdoor mask wearing really is not necessary in most situations. Now, it's very carefully written. Americans who are fully vaccinated, meaning 2 weeks after your last dose, whether it's one dose or two doses, 2 weeks after the last dose, at least. Actually, with J&J, maybe longer. If you're fully vaccinated against coronavirus, you no longer need to wear a mask outdoors while walking, running, hiking, biking alone, or in a small group, including with members of your own household. Masks are still necessary in crowded outdoor venues like sports stadiums. That's what the CDC has said. Joe Biden coming out and announcing the same thing. The CDC stopped short of saying if you're vaccinated, you just never need a mask outdoors. They say that it's still conceivably possible that you could transmit coronavirus, and that with unknown vaccination levels in crowds, it's safer to wear a mask, even if vaccinated, in a big crowd. Now, I think this makes perfect sense. Unfortunately, there are some doom and gloomers who are furious, and we were live streaming Joe Biden announcing this yesterday, and I had people saying, David, you can still pass it even if vaccinated. Well, yes, you can, but transmission is reduced by more than 90%. And outdoors, it's almost zero. Pre-vaccination, Dr. Ashish Jha believes 1 out of 1,000 cases were transmitted outdoors. That's before anyone was vaccinated. You are really talking about percentages and a risk level that is lower than the flu when you're talking about an increasingly vaccinated outdoor situation. I've been following the guidelines. So even though from the beginning I thought if I'm biking on the bike path, I don't need a mask. But after getting some dirty looks, yes, the judgment worked on me. And I put the mask on when biking or when running or whatever. We are now being told very clearly by the CDC that certainly at least vaccinated people do not need to do that. Now, the CDC director, Rochelle Walensky, emphasized a bigger interpretation than the narrow wording of the CDC, saying, quote, "We no longer feel that the vaccinated people require masks outdoors other than large public venues, period." And one really interesting thing is that the CDC has also put out a sort of pictograph that shows a list of activities, the risk level if you are unvaccinated, and the risk level if you are fully vaccinated. The risk level for fully vaccinated people is color-coded green, meaning low risk, for every activity, including going to crowded outdoor events. The venue and the recommendation may still be to put a mask on in that situation, even if vaccinated. But the CDC making clear, if you're vaccinated, the risk level for a big concert is low. The risk level for going inside at restaurants is still low. Now, of course, it will continue to be lower as more and more people are vaccinated. If you individually have a higher risk profile, then that may not be something you want to do right away. And we're going to talk about that later in my segment about Joe Rogan's recent comments. But hopefully, the point here is that hopefully this will encourage more people to want to get vaccinated. That is increasingly an issue that we are dealing with in the United States. While many countries are still having major supply issues with vaccines, in the U.S., increasingly the problem is lack of demand. It's actually tragic. So many countries desperate to get vaccines they haven't yet been able to get. In the U.S., more and more states are going to just show up. You don't even need an appointment. And they're still not filling every slot. So hopefully the word from the CDC and Biden that the masks can come off for vaccinated people in almost every scenario will encourage more people to want to get vaccinated. The counterpoint is, if you still don't want to get vaccinated, you probably don't care what the CDC says about masks. And that certainly is a source of concern. Let's now talk about some of the reaction from the media to Joe Biden's announcement of what the CDC has determined regarding masks. This is probably my favorite Joe Biden moment from his presidency thus far. And it came during yesterday's White House event where outdoors at the White House, Joe Biden announced the CDC has new guidelines. We have been vaccinating enough and the vaccines are so effective that masking outdoors is no longer necessary for vaccinated people in most situations. This was a great announcement. This was really a sign of progress. And Joe Biden did walk out to that event wearing his mask. He took it off to speak, and he announced masks are no longer necessary outdoors for vaccinated people. He was a vaccinated person outdoors taking off his mask. And Peter Alexander from NBC News was just desperate. You could see desperate to generate controversy. I've talked before about how in the absence of real scandals, the likes of which we saw during the Trump administration, under Biden, reporters, even reporters that generally are just asking good questions, they are just beside themselves to figure out some controversy, some gotcha against Joe Biden. So Peter Alexander from NBC News, eager to ask a question about Joe Biden's mask, Joe Biden first putting on his sunglasses, not his mask, and saying he will take a couple of questions one at a time.
One at a time.
So then here is the question from Peter Alexander. Sir, you came out with a mask, but you're saying masks aren't necessary. Explain that. Isn't that a double standard? Isn't it? Why would you wear the mask if the announcement is that they're not necessary? Here is Joe Biden's answer.
And you chose to wear a mask, sir. You chose to wear a mask. You chose to wear a mask as you walked out here. What message were you sending by wearing a mask outside alone?
By watching me take it off and not put it back on till I get inside.
Do you have any
This is just hilarious. I mean, well, when I came out with the mask, I hadn't yet announced the new mask guidelines. I took the mask off and announced them, and now I'm not putting the mask back on because I've explained why to the American people. It's just so petty and so embarrassing. And then Fox News reported on the question being asked, like asking Biden about this and noticing his mask is some kind of hypocrisy. This is now Fox News after the event saying, oh, yeah, lots of people were noticing that.
But he didn't do that. He walked from the White House alone wearing the mask to the podium. And of course, it was something we noticed right away. And now, of course, you look at your social media and it's what everyone's talking about.
Just overjoyed they are over at Fox News about Peter Alexander, a reporter from another network, just kind of being made a fool of, just having a grand. They really got him there, didn't they? And the other thing is that even the framing of all this is wrong. The lower third on Fox News during that clip was Biden relaxes outdoor mask guidelines. Biden has done nothing. The CDC has relaxed outdoor mask guidelines, and Joe Biden listens to the public health experts. This is not a trivial difference between the Trump administration and the Biden administration. Trump would often come up with his own ideas that had nothing to do with public health official guidance on masking, on maybe injecting bleach, on would a flu vaccine deal with coronavirus? Remember that beauty towards the beginning of the pandemic, and on and on and on. Biden has done nothing. Biden has just announced, hey, great news. Because of what we've all been doing together, vaccinating ourselves and so on, the CDC has now been able to announce this. And I'm glad to let you know that this is what they've decided. The whole framing is off. The forced laughter in the clip is deeply bizarre. Everything about this is strange and pathetic. Now, the other totally hypocritical and transparent thing is all this time they've been saying, don't make me wear a mask, which really they should be saying to their governors, not Biden. Remember, Joe Biden passed a federal mask mandate in the sense that it applies to federal buildings and federal employees and so on and so forth. Governors at the state level decide on state level mask mandates. The CDC makes recommendations. Joe Biden can amplify those recommendations, but it's really governors. But you've got these people who've been saying, do not make me wear a mask. Now that Joe Biden says, hey, great news, the CDC is now okay with no more masks outside for vaccinated people in most situations. They're still not happy. Now the problem is, well, why did Biden wear his mask on his way out to say this? The last guy wondered aloud about injecting or drinking bleach, and they're making fun of Joe Biden for wearing his mask to a mask-related announcement. As I've been saying for weeks now, when these are the controversies, when this is what Fox News is focused on, Joe Biden is probably on the right track in terms of just keeping his head down and doing things and avoiding scandals. Do we want him doing more things? Of course. Do we think everything he's doing is perfect? No, of course not. But when the scandals are so pathetic, fake news about meat eating and plant-based beer, on and on, Jill Biden and Joe Biden's relationship is stage managed, whatever. When those are the scandals, he's avoiding real scandals, that's for sure. We will have more on the new mask guidelines. And again, there are people in the audience that are mad about the new mask guidelines. They seem eminently reasonable, and they aren't that you can't wear a mask. If you aren't vaccinated, the guidelines are still wear a mask outdoors. And even if you are and you just want to wear a mask, you can. It's sort of like my example from the Tucker episode. If you want to wear a winter hat in the middle of summer, go ahead and do it. I think that these are eminently reasonable new guidelines, and that they will hopefully encourage some more people to get vaccinated. We'll have reaction from you on our Instagram account. Follow the David Pakman Show on Instagram at David Pakman Show. We'll take a quick break. The Joe Rogan anti-vaccine claims coming up next. The number one funding source for the David Pakman Show has been and continues to be membership. And membership is not just a feel-good thing. You get access to the world-famous bonus show every single day just for members, as well as commercial-free audio and video feeds of the show day in and day out. You can sign up for membership very, very quickly at joinpakman.com. That's joinpakman.com. If the normal prices strike you as high, by all means, use the coupon code BETTER21. All one word, all lowercase. Become a member today. Okay, so I'm going to criticize something Joe Rogan said on his show about coronavirus vaccines recently, but because of the emails I've been getting, I first want to say a couple of things. First of all, I haven't been avoiding criticizing Joe Rogan because I've been on his show or because of some loyalty to him. I'm not doing this segment in secret, hoping Joe Rogan never sees it. I am not regularly in touch with Joe. We've been in touch a couple of times since I was last on. Everything I'm going to say here, I would say to Joe if I were back on his show. This is a disagreement about the vaccine. We would be able to talk together about it and everything would be fine. It's not some weaponized hot take or call out. I haven't avoided criticisms of Joe Rogan more than I have of anyone else. I just don't watch much stuff. When people send me something from his show or others, I look at it. The Dan Crenshaw example from a few weeks ago is an example. So let's just jump right in. Joe Rogan made statements on his show about vaccines that I believe are dangerous in what they are encouraging people to do. And the risk that they discount if they follow Joe Rogan's advice is significant and it has to be addressed. So let's look at the first clip and we'll jump right into this.
And people say, do you think it's safe to get vaccinated? I've said, yeah, I think for the most part it's safe to get vaccinated. I do. But if you're like 21 years old and you say to me, should I get vaccinated? I go, no. Yeah. Are you healthy? Are you a healthy person? Like, look, don't do anything stupid, but you should take care of yourself. You should, if you're a healthy person and you're exercising all the time and you're young and you're eating well, like, I don't think you need to worry about this.
Yeah, I tend to agree with you.
This is not about you worrying about getting COVID if you were 21 and you don't want the vaccine. When we say the vaccines are 92 to 95% effective, that means 92 to 95%. In some people, they are less effective. Joe's thought process is only about the 21-year-old evaluating their own risk. But what about the risk of others? I don't have to give you a hypothetical. My dad has a type of blood cancer called multiple myeloma. They recently did a study of vaccinated multiple myeloma patients. In them, the vaccine is 50% effective. It's one study. But they took a group of vaccinated multiple myeloma patients. 2 weeks after their second doses, they checked their antibodies. Half of them did not develop antibodies. So my dad got vaccinated. I got vaccinated. My 17-year-old sister vaccinated, right? We all did it. But at some point, things will go back to normal. You won't need masks in grocery stores or at the car mechanic or wherever else. So masks are done. The 21-year-olds don't get vaccinated because they follow Joe Rogan's advice. My dad goes to the grocery store and some 21-year-old who didn't want to get vaccinated spreads it to my dad. It's not some hypothetical of, oh, I need a mask on the bike path. You all know I'm not big on the outdoor masks. I never thought we needed them except in rare big crowds. This is the vaccine cuts down your ability to spread the virus by 90%. It reduces the amount of virus that is in the systems of vaccinated people. My dad has a 50% shot of being immune with the vaccine. He did everything he can. He got vaccinated, but he goes to the grocery store or the DMV and it's filled with 21-year-olds that heard Joe Rogan say, if you're 21 and healthy, you don't need to be vaccinated. Well, it's not about your level of risk necessarily. It is about you as a 21-year-old, as a non-vaccinated person, could be infected and incubating with a large viral load because you're not vaccinated, and then you spread it to other people. The vaccinated 21-year-old has a reduced ability of spread, 90% reduced. That protects my dad and the 5 to 8% of people who get vaccinated but do not develop immunity. It is not just about the 21-year-old. Now, if you don't care about others, if you're the 21-year-old and all you care about is yourself, okay. But it's dangerous to say that that's the only calculation if you understand the importance of considering other people living in societies. The principle at play is if you aren't likely to die yourself, maybe don't get vaccinated. That's what Joe Rogan is saying. It doesn't work. Most people individually are not likely to die from the virus. If we went by that, we would never get anywhere close to herd immunity. Let's continue.
Yeah, I tend to agree with you.
But there's a lot of jobs that will tell you need to have this.
Well, that's what's starting to happen now.
People are worried about them doing it for their children. And we talked about this earlier.
Yeah.
There's that you might have to have your children vaccinated. And, I can tell you as someone who's both my children got the virus, it was nothing. I mean, I hate to say that. If someone's children died from this, I'm very sorry that happened. I'm not in any way diminishing that, but I'm saying the personal experience that my children had with COVID was nothing.
So again, same issue about his kids versus his kids spreading it. The longer this goes, the more the spread is shifting to children. So it's not just about the kids. It's about other people that the kids might spread it to. People who might be vaccinated, but could be in the 5 to 8% who don't develop immunity. Or if you're immunocompromised, it might be more like 40 or 50% don't develop immunity. And then also this thing about vaccine requirements. Schools have required vaccines for decades. That's just an aside. We've dealt with that before. I don't feel the need to go into that too far. But there's nothing new or unique about vaccination requirements for schools. Let's keep going.
One of the kids had a headache. The other one didn't feel good for a couple days.
Yeah.
Like, maybe, I mean, not feel good, like no big deal. No coughing,
Right.
no achy, no like in agony. There was none of that. It was very mild. It was akin to them getting a cold.
Yeah, and you can have this thing where it's like you were saying, this virtue signaling and this kind of like theatrical display of I get the vaccine, what a good person I am, I care about everyone. But you're like, look, my daughter's a lot younger than your kids, but I'm like, yeah, I'm not injecting my daughter with something to fucking virtue signal. Like, I'm not doing that.
Right.
If there's something that she's of no risk, statistically has no risk from, I'm sorry, I'm not taking any experiment on her in that. And that's my attitude
But
toward
it's
it.
amazing that that's controversial.
Yeah.
The reason that it's controversial is that it's based on nonsense and ignorance. I am right there with the fact that there is some virtue signaling and theatrics around COVID guidelines. I have said the masks outdoors, when you were walking on the bike path or passing someone on the sidewalk, I have seen no evidence that it was ever necessary to wear a mask in that situation. I'm not interested in virtue signaling. I am not, one of these lockdown lovers that people on the right like to say, shut everything down forever. No. When 2 weeks ago, vaccinated Joe Biden and vaccinated Kamala Harris were on a stage together, outdoors, alone with each other, and they both wore masks while the other spoke, I said there is no reason for that. Maybe you do it for theater so that other people see it and maybe they behave more safely. There was no reason for that. But vaccinating people not at risk themselves to protect others is not virtue signaling. It's not controversial. It's just caring about humans. Then this other guy also says, an experimental drug, the vaccines. Listen, if you don't trust mRNA vaccines for some reason, there's no reason not to. But what I'm saying is, if you don't trust mRNA vaccines, there are so-called regular vaccines available for the virus, like the Johnson & Johnson vaccine. Oh, but David, the blood clots, 1 in 1.2 million, all women age 18 to 48. Their kids are not in that group, okay? If you don't want an experimental mRNA vaccine, then you get the J&J. There's an answer to that as well. Let's watch one more clip.
That even saying that I'm not going to inject my child with the vaccine is controversial.
Yeah.
It's crazy because, again, we are not talking about even the flu that we just found out killed 22,000 people last year. We're not talking about that.
Right.
We're talking about something that is not statistically dangerous for children. But yet people still want you to get your child vaccinated, which is crazy to me.
Yeah.
Like, you should be vaccinated if you are vulnerable.
I actually don't know why the focus is on they want you to get your child vaccinated because the vaccines aren't even approved for kids yet. Now, at some point, after rigorous testing that's ongoing, it might be soon, the vaccine or multiple vaccines might get approved for younger kids. It's not even approved right now. So this is genuinely disheartening to see. I have no issue with Rogan personally. I'm glad to talk to him anytime if he wants to have me back on. I'm not saying anything I wouldn't say to Joe. If I spoke to him, I'd say, Joe, I'm worried about this for the reasons I just outlined. I don't assume that he's doing this because he's a bad person, because I've seen no evidence he's a bad person. I think he's just mistaken. And it's not sensible commentary. And because so many people consider what Joe Rogan says to be gospel, I am worried that lots of the 20-something-year-olds in Rogan's audience will hear this and say, yep, that's why I'm not going to get the vaccine. I'm a healthy 21-year-old, just like Joe Rogan said. And unfortunately, that is a recipe for never getting out of this in a serious way. If you care about other people, this is not good advice, mathematically, medically, statistically. And I'm glad to talk to Joe about it anytime. Tonight, Joe Biden will be delivering his first joint address to a joint session of the House and Senate. But it's not called a State of the Union address. Often in a president's first year, the State of the Union is just not called the State of the Union. And sometimes it's not in February or January. It's coming in April. And we will be live tonight on YouTube, Twitch, and Facebook with Joe Biden's first address to a joint session of the House and Senate. We now have learned that tonight Joe Biden will propose a $1.8 trillion plan, which will include national paid family leave, universal pre-K, free community college, subsidized childcare, and a whole bunch of other things. Now, will it pass as proposed tonight? Of course not. Of course not. It never does. That's the same with every president. This is the starting point. But Joe Biden will be introducing his American Families Plan tonight. It is part 2 of the so-called Build Back Better economic agenda. There's the $2 trillion roughly infrastructure and jobs plan that was released earlier this month. This is now going to be the next piece of it, a $1.8 trillion package. It is being called a generational investment in the future. It is billed as something that will help us compete with China. It will transform the U.S. economy. And it includes $1 trillion in spending over the next 10 years and an additional $800 billion, which would be targeted tax credits for middle class families. The proposal also includes cracking down on tax loopholes used by high income tax filers. Joe Biden wants to nearly double the capital gains rate from 20 to nearly 40% for households making over $1 million a year. I don't think that's going to happen, but it's nice that he's proposing it. $225 billion for national paid leave, another $225 billion for childcare. And of course, Republicans have already been criticizing it. They will be against it in their rebuttal tonight to Joe Biden's speech. They will come out against it. What's my thought about this? I think that it is a very reasonable initial framework. We've talked before about, but how will we pay for it? First of all, that's never asked about how do we buy missiles. It's never asked about how we pay for war. It's never asked about how we pay for tax cuts for the rich. It's asked by Republicans when it's actual programs that they believe are either wasteful or that go to people who are undeserving in some way under this umbrella of the morality that they apply to who deserves something from the government. Of course, they're going to be against it. Our new framework for understanding debt and deficit is that not every dollar of debt is created equal. If we take on $1 of debt to give a really rich person a tax break, statistically, most of that money they save just sits in a bank account with a relatively low economic multiplier. If we accrue $1 of debt in order to give somebody a better education, which allows them to earn more later in life, paying more taxes into the government, or if we take on $1 of debt to give someone health care that doesn't otherwise have it, so that now they can get a preventive treatment rather than going to the doctor when they are already sick. And then they miss fewer days of work and earn higher wages. You understand how there are stimulative reasons for the government to deficit spend and less or non-stimulative reasons. The framework here is that most of this stuff would have a higher economic multiplier than just tax cuts for the rich. Now, do I think that this is going to pass as proposed? There's no way in hell. There's no way in hell, because even Democrats are not unanimously on board here with the things that Joe Biden is going to be proposing. So I think that Joe Biden is very well positioned right now with the success of vaccination, the passage of the $1.9 trillion COVID stimulus. Joe Biden has a lot of political capital right now. We've been wondering, how is he going to choose to spend it? And it is going to be on this $2 trillion plus now $1.8 trillion package. Now, I am not looking for, I think I'm committing, we'll see. I think I'm committing not to deal with the really predictable right-wing opposition, which is, where are we going to get this $4 trillion? It's just like, I'm tired of it. I've done deep dives on exactly where we can cut spending. I've explained modern monetary theory and the reality about how a country's debt is not the same as a household debt. We've done it all. So if they're going to just come out and say, we don't have the 4 trillion and we can't keep, quote, printing money, I'm so tired of that. Maybe I'll address it in passing, but I'm not going to address that in detail. I'm more interested in hearing from Republicans good faith critiques of why the spending specifically is not a good investment in the future of America. Like, actually tell me, okay, he wants to do free tuition on community college. Why is that bad? It seems to me that it is, number one, a great alternative for 2 4-year schools for people for whom maybe that's not the best fit. It is a great feeder to reduce the total cost for people who ultimately do want to go to a 4-year school and earn a bachelor's degree. It seems economically stimulative. It will make us more competitive. Tell me why it's a bad idea to spend money on that rather than just throwing at me, well, 4 trillion, where's Biden getting it? Come on, that's pathetic. That's flaccid. It's a very flimsy criticism. So I'm hoping to engage more substantively with criticisms that are made in good faith and that are not just the same old thing we've heard time and time again. That's tonight. Joe Biden will announce it. I will be live starting at 8 p.m. Eastern on YouTube, Twitch, and Facebook, and I hope you'll join me for that speech tonight. The David Pakman Show is audience-supported media, and you can contribute any amount you want on Patreon, as little as $1 per month. Plus, you can get the daily bonus show, world famous at this point, and the daily commercial-free TV show by making those pledges at patreon.com/David Pakman Show. This is audience-supported media. We depend on the support of our viewers and listeners. Whether you listen to the podcast, watch on YouTube, or watch us on TV, or even listen on the radio, patreon.com/David Pakman Show. Okay, let's jump into a few other things here. Sean Hannity, the Fox News host and propagandist, friend of Trump, he's refusing to say whether he has been vaccinated against COVID-19. And I have some thoughts as to why he's doing this. So we're going to listen to this. This is audio from Sean Hannity's radio program. I think that to some degree, Hannity is in a weird place now where he's kind of depressed that the guy he cozied up to for 4 years lost and is out of power, and increasingly people are no longer paying attention to Hannity either. So I think there's a bunch of things going on. But let's jump in here, listen to Sean Hannity, and talk about why he's saying what he's saying.
Everybody knows about masks.
Right.
Everyone knows about social distancing. Everybody knows the vaccine's available pretty much now to anyone if you're over 16. Everybody knows what level of risk they want to take. Look, my attitude is, do your studying, know the science to the best that we can even say we have science involved in any of this.
So that's kind of that aside where they love to throw in the idea that because our understanding of certain aspects of the virus have changed over the last 14 months, can we ever really trust anything that's coming from the scientific community? And this is part of the virtue of science. That science is a process that is self-correcting, where there are rewards for correcting information that previously we misunderstood. And in fact, that should make us trust more in the process. Okay, let's continue.
Because they've gotten so much wrong. The great Dr. Fauci's been wrong so often.
Okay, so maybe I should have played that first before mentioning. But again, the fact that Fauci early said one thing about masks, but then for the last 12 months has been saying the same thing, that's not a reason to discount what the medical science community tells us.
And the only thing I would ask everyone is to be considerate of other people, especially older people, those with compromised immune systems, comorbidities, grandma, grandpa, mom, and dad.
And if by that he means even if you are not at high risk, get vaccinated to protect them, then I'm with him. I'm not sure if that's what he means.
So that if, at this point, I would assume that they're probably vaccinated. At least they have the opportunity to get it. If they didn't, that's another thing. Why do you have to answer the question? Oh, have you gotten your vaccine yet? Which vaccine did you get? How about it's none of your business? How about, what do you?
Well, I mean, it's called making conversation. It's also, listen, right now, if my friends want to gather indoors, I ask if they're vaccinated, and I say, we're only doing indoor stuff with vaccinated people right now, other than very, unvaccinated but work from home because I'm vaccinated. Okay. it seems like a responsible question to be asking. You can decline to answer.
What do you mean you're not going to get vaccinated? How about that's a choice between an individual and a doctor? I'm very pro-science. I'm not anti-vaccine, but I'm also medical. I also am a libertarian believer in medical privacy. It's unbelievable. Everyone wants to know.
Medical privacy applies to practitioners, and it applies to records, and it's not about nobody can ask. I mean, essentially, you know, he's almost saying you shouldn't even be allowed to say, how have you been doing lately? This is not what medical privacy means.
It's like everyone now, I'll tell you, I probably would have told people my decision until everyone started demanding that I tell them what my decision is. My advice to everybody is research long and hard on everything you can get your hands on, and you can read the medical literature. Then I would look at your special and unique medical conditions.
See, this is really stupid because, first of all, it's not really that difficult to figure it out. Secondly, looking at your specific situation is, again, the kind of Joe Rogan thing from earlier of if you're not at risk, maybe you don't get vaccinated. And if you read everything that's out there, as he suggests, a lot of what's out there is anti-vaccine trash. And that's what a lot of his viewers are finding on their Facebook accounts.
Your health and talk to the doctors that take care of you. Or
again, sure, ask your doctor. Most people don't need to have a conversation with their doctor about whether they should get vaccinated.
Doctors that you respect in life and make an informed decision. And that's got to be an individual decision. And are there people that have had reaction to the vaccines? Yep. Should you read about that too? Yes, you should. Read it all.
I think it's good to understand the level of risk with getting vaccinated, which is extraordinarily low, and in all cases lower than the risk of getting the virus. But that's fair. You should know that, 1 in 1.2 million of the people that got the J&J, women age 18 to 48, had a blood clot. Maybe if you're in that group, you opt for a different vaccine if that's a degree of risk that concerns you. I agree with that.
No, I'm not. How can I possibly weigh in on whether everybody needs to be vaccinated? I don't know people's individual medical conditions. That is not my decision. That's your decision. You have the right to make your own decision. You can take whatever level of risk you might want to take. I just ask gently, think of other people, and especially those that would be more susceptible for the worst outcome in all of this.
So some of what he's saying is okay, but then also, when his refusal to say, I would have told people my vaccination status until everybody started asking. That to me sounds like a cop-out where Sean Hannity was vaccinated. He doesn't want to say it because saying it will anger the anti-vax people in his audience much more than not saying anything will anger the vaccinated people in his audience. It just feels like a calculation to me. And interestingly, this isn't that dissimilar from what Donald Trump did in the sense of Trump was vaccinated at the White House in January. He didn't mention it. He said nothing. And then months later, when out of office, he said, oh, yeah, I did receive it, or it was announced by his office that he received it at the White House. It strikes me as a calculation more than it is about so-called medical privacy, but really strange stuff happening over on the Hannity program. And bottom line, I think Hannity's kind of depressed that his guy is no longer in office and people are paying a lot less attention to him than they used to be. He's getting no more rides on Marine One, but make of it what you will. Pharmaceutical company Pfizer says that an oral drug for COVID-19 could be ready next year. Pfizer is working on 2 antivirals, an oral medication and an injectable. The company started an early stage clinical trial of the oral drug last month. The drug blocks a critical enzyme that the virus needs to replicate. It's very interesting. Here is Pfizer CEO Albert Bourla talking about this morning on CNBC.
Around this summer, what do you think is a reasonable time frame, Albert, for a small molecule antiviral pill like that to get through phase 3 and actually to get out there and potentially be available if all goes well?
Meg, if all goes well and we implement the same speed that we did so far, and we are, And if regulators also do the same, and they are, I hope by the end of the year.
In this next clip, they talk about the oral versus the injectable. And again, this is Albert Bourla, CEO of Pfizer, who made $18 million in total compensation in 2019. Let's listen.
Albert, there's in a New York paper, it's the Post, admittedly, but COVID cure may be ready this year from the Pfizer drug, and it's a I know you know which one I'm talking about. PF 07321-332 is what it said, but it prevents a replication of COVID in the nose and could be an oral medication, and they're calling it a cure, could be ready next year. Is that headline accurate?
Well, it is accurate that we are working in antiviral. And we are working actually on two. One, it is injectable, and the other one, as you just said, it is an oral. And particularly the attention is on the oral of the world and of us, because provides several advantages. And one of them is that you don't need to go to the hospital to get the treatment, which is the case with all the injectables so far. But you can get it home. That could be a game changer. The compound that we are talking about, and you said very well the numbers, it is a protease inhibitor. The good thing it is that this is also the first molecule that is coming from this type of class. This is a good thing because you can combine it with other classes. Also, the mechanism of action, it is such that it's not expected to be subject to mutations, particularly because it's not acting on the spike. As we all know, all the mutations that we are hearing right now are changes in the proteins of the spike.
So this is not a trivial detail. An antiviral like what is being developed by Pfizer would not be as jeopardized by mutations and variants. That's really important. And of course, if all goes as described, and there's still much to be determined here, this could be a real game changer. Now, I have to tell you, it is not lost on me that as Albert Bourla is speaking, the stock price of Pfizer is on the screen as their CEO is talking about medications they may soon have. This is a really stark reminder of the system that we have, and I have addressed this before. I believe there has to be a middle ground here. On the one hand, we can't allow pharmaceutical companies to hold us hostage when it comes to our health. On the other hand, I don't expect the best and brightest minds to line up to solve our problems as a charitable contribution. I just don't expect that to happen. The creators of these treatments, vaccines, etc., should be rewarded. They really have done something incredible. The Turkish couple in Germany who developed what is now called the Pfizer vaccine, they make a profit by doing this. They will then be likely to do it again. And they will be more likely to come up with other cures, treatments, vaccines when the next pandemic comes around. If there's no profit now, who will invest next time? For now, Pfizer has increased revenue about 2% after investing about $10 billion researching the vaccine. They took some risk of investing in a COVID vaccine. They could have done oncology stuff, which has higher profit margin. Okay. The same applies to the researchers. The founders of BioNTech are now really wealthy. But don't we want people to enter the field of science and develop things that can be life-saving? But we need to ensure access. We need to look at government subsidies. And there's a concept in healthcare where premiums can't exceed benefits by a certain percentage, or a portion of the premiums have to be refunded to the consumer. Maybe allowing pharmaceutical companies to have a margin that's fair but limited would work. I don't know. I'm just thinking out loud. There are certain people I don't mind seeing being paid handsomely, right? If I had kids, my kids' teachers and doctors, firefighters, people developing vaccines to deal with a pandemic. Should the government be involved in determining a fair price? Yeah, maybe so. But context is crucial here. Bernie Sanders made a statement about this, and he made a statement about vaccine production and delivery outside the U.S. and allowing other countries to use the IP, the intellectual property of U.S. companies to make vaccines, and instead of having to wait around for the U.S. companies. Those are great ideas. The government should be involved. But in a sense, I am more pleased with people involved in biomedical research making money than in some other areas. Now, does the CEO deserve 18 million? That's a very different question, and one that I think we can fairly debate And, the counter is always, well, if you only pay $2 million, then some mining company will sweep them up instead of a pharmaceutical company. And maybe the pharmaceutical company will be slower. Okay. There's maybe a debate there. But I think that it has to be a middle path here. We have a voicemail number. That number is 219-2-DAVID-P. I think this is a Republican caller explaining why educated Republicans are abandoning the Republican Party. Let's listen.
It's easy to see why educated people are abandoning the Republican Party in droves.
And by the way, this is not Jimmy from Philly. I know the accent is similar. This is not Jimmy from Philly.
David, it doesn't take a genius to figure out that when John Kennedy asked Stacey Abrams what her problem is with voter suppression, he's just assuming that everybody is as stupid as he is. Right? He doesn't realize that smart people aren't stupid and that he's a stupid person. And so, stupid people can't call smart people stupid and expect them to hang around in their club.
Okay.
That's stupid. Smart people are sick of being called stupid by Republicans. So obviously they're not going to stay in the Republican Party.
Wow. Okay. I think I get it, maybe. But what is true is that educated voters are leaving the Republican Party to a greater degree. Okay, good. I think we've sorted something out, maybe, but maybe not. We have a great bonus show for you today. We will talk about West Virginia giving $100 savings bonds to young people who get vaccinated. A Florida McDonald's is now paying people $50 just to show up for an interview. Why? We will discuss it. And a man has been charged with infecting 22 people with COVID after going to the gym and work with active symptoms, not in the United States. Could this happen in the U.S.? We will discuss that and much more and preview tonight's live stream of Joe Biden's speech. On today's bonus show, get instant access by becoming a member at joinpakman.com or a patron at patreon.com/David Pakman Show. We have the beautiful coupon code, secret coupon code on our website for membership discounts. Immoral21, all one word, all lowercase. Immoral21. Sign up. I will see you on the bonus show and then hopefully tonight for the live stream as well. Thanks a lot for watching today's show. I just want to take a second to tell you about today's sponsors. Blinkist is the app that helps you become a more well-rounded person by letting you read or listen to an entire nonfiction book in just 15 minutes. You can try it for free and get 25% off a subscription by going to Blinkist.com/David Pakman.